Good afternoon, everyone. Thank you for being here. We'll go over some data, talk about some relevant facts, and then take some questions. No new deaths over the last 24 hours. We've lost 212 residents directly related to the pandemic since March 16th. Slight little bit of good news there. We've received 5,376 tests back last 24 hours. 7-day rolling average for our positivity rate, 1%. Good from a macro standpoint. From a micro standpoint of looking at what's impacting us today and how that could jeopardize that, we got a lot of work ahead of us. Hospitalizations, 26 individuals in the hospital, 5 in the ICU. Let's keep those 5 individuals in our thoughts and prayers, please. Out of those in the hospital, 18 Caucasian, 5 African American, 1 Asian, and 2 have not shared their demographic information with us. Looking at overall cases, we've now had 5,251 cases. That's 50 new cases since yesterday. What is 50 cases telling us? What story? 4 travel, 1 Pennsylvania, 2 Virginia, 1 from another part of the state. 12 contacts, household contacts, so a pretty large household contact number there, about a quarter. Positive there is these folks are in a quarantine already. We have to then go and reinvestigate what we have seen there, but usually those investigations are shorter and less time consuming, and the risk to the rest of the public at large has been there. And so that's positive. But 31 related to community spread, 15 at known source, and 2 being contact traced in 1 senior facility. So certainly when you look at this, 50 is a lot of work, right? If we're doing 5,000 tests in a day, the percentage isn't really, it's still very strong. If you look at our percentages compared to the other 7 or 8 large counties in New York State, we're still the best, if not the second best, on a daily basis. The challenge is we're experiencing a seasonal shift now, and for us to avoid a second wave, which then jeopardizes our hospital infrastructure and our ability to treat our sick, we have to start modifying some of our behavior now. And so we'll go through that after a little bit more data here. 2,964 female, 2,287 male, 655 under 19, 1,152 in their 20s, 709 in their 30s, 631 in their 40s, 749 in their 50s, 534 in their 60s, 352 in their 70s, 299 in their 80s, 170 in their 90s. When higher ed out of today's cases, 9 higher ed cases out of the 50. 1 of them is a transfer in from outside the community. 3 lower ed cases today, K through 12, and I believe 1 of them is a remote learner. Yes, 1 was a remote learner, so not exposed to any building. So really 2 out of the 50. So a couple things for the public to understand. I know when we thought colleges were going to come back, that was going to be our spike, right? Remember all that? The risk of colleges? It didn't happen. Then the second thing was our spike was going to be when we started K through 12. Did we have more cases? Yes, we had cases. Were they happening or have they been happening in the schools? No, they have not. So our spike wasn't college and our spike wasn't K through 12. Our spike has been community spread, which is the rest of us. And so it's the actions in the community that are driving the uptick in cases. So I just want to reiterate that when you have all these kids going to school every day, and we got 2-3 cases a day. That's really not a lot. These kids aren't getting it in school. They're getting it outside of school. Then they're just going to school. So wanted to just talk about that. Related to school testing, we've shifted the NBT Bank Stadium site to the F shed of the regional market. This is correct, Dan? That's where it was today? Okay. Still two lines, essentially 2 labs working. Upstate, saliva test. You can call 315-464-2582. Select option 4, or you can go to and create a MyChart account on Upstate at mychart.upstate.edu. Pre-register. This is a popular test. It's the least intrusive test. We're doing about 150 to 180 of these a day at now the F shed at the regional market. Secondly, our Cayuga Health Lab. Again, you can pre-register at register.cayugahealth.com. You can just show up and get tested there. This is your diagnostic test. Again, through our partner. Right now, these are for symptomatic individuals related to school. On Tuesday of next week, we will expand the Cayuga lab to anybody with symptoms in the community. So anybody who's symptomatic can go to the F shed and go get your diagnostic test through Cayuga next week, as we have some capacity there to expand that. Asymptomatic saliva-based school sampling. We've been going from district to district, working with teachers on a voluntary basis, looking for that asymptomatic case. Last week we had no positive pools. This week we have found a positive pool, so it worked. And so we will continue to do that asymptomatic testing in buildings. Why are we doing it? We want to find that asymptomatic carrier of the virus. Just like we implemented this strategy with seniors, independent living, assisted living facilities in the beginning of the pandemic to help us drive our numbers down, help stop infection, protect the loss of life, we're now doing that in our schools. The good news is the program's there, and we have found an asymptomatic carrier in the schools. And so that is positive. Halloween weekend. We are very, very concerned about the activity and how we need to, with this virus, we don't know. We've been messaging very hard. I know the media has been covering this very hard for the last 10 days about how we are seeing more pressure now and how we need to stay at home and get a COVID test. We need to be smarter about the social gatherings we're in. I don't know if we've stopped the bleeding yet, and people have done that. It takes 2-3 weeks for us to see that in data. But what I will tell you today is yesterday was 70 cases, 69 of them transmitted in Onondaga County. Today is 50 cases, 49 transmitted in Onondaga County. And tomorrow will be the highest case number out of any day we've had yet in the pandemic. So what do we have in front of us? Did we stop the bleeding and now we're modifying our behavior and we'll see it in 2 weeks from now? But I know we have a Halloween on a Saturday, which leads to more social gathering. I know we have trick-or-treating. I will be going trick-or-treating with my children, and we will be going as a family. I suggest we do the same thing. Everybody, small groups with people that you're around all the time. And so what we used to be able to get away with in the pandemic in the summertime are outdoor barbecues, family and friends, neighbors. We can't get away with indoors. We're seeing cases, birthday party cases, wedding cases, golf tournament cases. We are using the data, just like we always have, to drive decision making. The data for the first time shows two glaring issues with bars and restaurants. So this weekend, we'll warn everybody right now, we're coming out with a very aggressive enforcement detail this weekend. And we're going to be looking for those who are not following the rules. Why? Because there are more cases coming out of bars and restaurants. We don't need a couple bad actors to screw our data up to the point where we're going backwards on an economic reopening. So the data for the first time tells us we have a problem in these establishments. We're talking to the owners of these. We understand that there's fatigue in the community with COVID. Everybody's tired of it, but it's the third quarter in the game. We can't get tired in the second half of the game. We got to finish the game strong. So the data says we have an issue related to this industry. We're going to be enforcing and making sure that those who are following the rules are, and those who are not will be fined. There will not be warning letters this weekend. There will be fines. Because of the increased pressure of cases, we were going to open up the branch libraries next week in our library system. We are now going to wait and see. Let's see if we can turn the corner here on this data a little bit, stabilize the data a little bit, and so we're going to wait on that decision for a couple more weeks as well. But this is an important moment for the community. We are doing essentially on the macro level. The data looks good if you just look at 1%. The contact tracing on each case is more complicated now than it was in the beginning of the pandemic. When the industries are shut down and people are inside and they just got sick, not a lot of contact tracing. So even though our data is good, we have a better reflection of how many positive cases there are in the community now than we did in May. In May, remember, we have 60 cases in a day. We go back, how many tests did we do to get to 60? 500 tests. That means there's a lot more than 60 people sick in the community. Now we have a better idea on how many people are sick in the community because of the testing, but that means we got to do all the work to get this thing under control so that we can keep our economy open the way it is today. And that's our goal, to keep the economy open. We can't do it by ourselves. We need people to get tested when they're sick, be smarter about your social gatherings, having 8 people, 10 people, 12 people, 15 people in the neighborhood inside for an extended period of time without mask wearing represents risk. Are you willing to take that risk? These are questions you need to answer. But these are all examples of what has happened and what is driving cases. Saying that, happy to take questions. I don't have that information yet. I just was told that we had a positive pool. So certainly it will show up in the data. I think they have to go through with the positive pool and identify the person. So certainly tomorrow we'll know what school district it is.
You said that you know that cases are going to be high tomorrow. Yes. How do you know that information? Is it symptomatic testing, general testing?
So each day we start getting through the state system. We start getting tests through the state system, and then labs fax us tests each day. So then what we have to do is we got all these tests. We got to figure out how many of them are duplicates, how many of them belong down to Onondaga County, and then we have our number. That's why our number is always a little different from the state's number that they put up. Some are duplicates. Sometimes the state will put up a number, and then there will be other cases that come in right after that, and we'll get that in the same day. So I'm not going to give a number tomorrow yet because I don't know what the final number is. I know it will be the highest number we've had.
You mentioned the testing expanding so it moved from NBT Bank Stadium to the F Shed.
Correct.
And it's now opened outside of school communities to anyone with symptoms.
Correct.
Is it similar now that it's that broad to what's offered at the community health center?
It is. We're working with local labs, so we have a little bit more. I don't know if control is the right word, but I feel like we have more control, and at least from a communication standpoint. Whereas when you're working with the national labs, it can be very fast, or it could, if you want to talk to somebody, it's probably a little bit harder, right?
1% you were saying is our infection rate, correct? So at what point do we start, moving back? Is there a percentage that you have? I know you guys are going aggressively, like you said, in restaurants and bars this weekend.
Yeah, so what we'll do with the data is we're in the seasonal shift now, right? It's shifted. There's more pressure on us. We're not going to see 10 cases a day again, probably till the pandemic's over, 20 cases. Maybe we get in the 20s a couple days. That'd be nice. but it's here. The virus is in the community. And so what we have done is we've been working well on the contact tracing with the state system. Our health department, and these are unbelievable public servants, and they haven't had a break. They haven't had a break in 7 months. So we're now, and everybody's tired, right? Everybody's fatigued with this, right? This is the last thing people wanted to, or we're here again, right? It's different than it was in the spring because we have the infrastructure in place to fight this. We're better at it. We know more about it. But the activity is going to be just as busy now. So we're now transitioning our contact tracers from other departments are now going back in to help the health department. We're taking the data. We know what industries now have led to more spread and what haven't, so we're going to enforce hard in those areas. Certainly, you know, all of this being done at the local level so that the state doesn't come in with an orange or a yellow or red zone, right? If we can actively do these things now, we're going to stay in this range. We'll still be one of the best in the state, and then the state doesn't come in to limit our economy in some of those zones like other counties. But if we don't do anything now, we will quickly find ourselves into a zone based off of the behavior that we're seeing.
In your tweet yesterday, you referenced a possible big cluster of cases. Can you tell us more about that?
We had we don't know how big yet, but certainly potential. There was a wedding where somebody came to the wedding sick, and they've gotten a lot of people sick.
Are these mainly young adults? I know you went through the list, but it's a lot of numbers that way.
Yeah, what we're seeing again, I mean, in the beginning it was, well, it depends on where the cases are coming from, right? I can't even say it's young people related to some of the restaurant bar activity. I think we cross, age boundaries there, right? There's a lot of middle-aged men that have gotten COVID recently, who might have spent some time at the, in certain areas. So overall, it's here. We beat this thing back so strongly in the summertime that we could get away with more, and now we can't. And so that's what I think people need to recognize. The gatherings that were okay outside don't work as well indoors. People are, I'm hopeful based off of our testing upticks, people are hearing our message. If you're sick, get a test. Some people do nothing wrong and they get sick. So what do we do then? We got to just box that in right there. Just nip that one right there, right? But certainly, in some of these restaurants do a great job, absolutely great job. And I don't want to demonize restaurants. We need restaurants open. We need them operating. They're small business owners. They're employers. It's our food supply chain. Some of them are doing a fantastic job. Some of them, clearly based off of the data, have been lax. And so we see that. So we're going to go and make sure that they're doing what they're supposed to be doing.
That was part of my next question. As you said, we meaning your team, has established that there are some issues in that industry. Are you seeing businesses not complying? Are you just seeing too many people getting sick in them, even though there is compliance?
We see employees going in sick, and we can't have that. So part of this will be educational process with the business owners. Get your employees tested, and then you can come to certain assumptions, right? And when you assume, you can spell it out what could happen to you, right? We've always said assume. If you spell it out what you can do, you can make a you-know-what out of you and me. But we're making educated assumptions that in some of these frequent flyers where we're getting cases from now, that people may not be sitting the whole time, and when they're standing, they may not be wearing masks or whatnot. So we're gonna validate that. We're gonna spot check, and we're gonna spot check when we think people are there, and when these things might happen. And I'm being transparent with everybody. So the health is driving this effort. The health data is driving the effort. Nobody worked harder to get restaurants open than yours truly. I got the state to move for outdoor dining before they were even open. So, and no one's working harder to keep them open than me. But there are it does seem that there is some of these establishments have gotten lax on enforcement. And if we're wrong, we'll find out we're wrong this weekend.
The positivity test rate of 1% is low because we're doing a lot of tests. The new cases per 100,000 population, what you see when you look at when you compare counties with that, the highest ones are like clustered in the southern tier and central New York, Portland, Brooklyn,
Right.
Onondaga. Does that concern you that there may be a regional brush fire
So what?
that we're part of?
Yeah, so we know a little bit about some of this. I think in Broome County you had community spread. Chemung, you had the Elmira Jail go through a situation where they had, I believe, 100 or more cases. So each incident has its own story. Certainly, Orange County, population-wise, closest to us, ran into a situation in the Orthodox community with spread there. So if you look at where Broome certainly was probably the most concerning in our neck of the woods because it was true spread. And we couldn't point to 1, 2, 3, 4 things that led to it. And they're still working their way through it now, right, with their positive rates still being well over 1%. We're larger. We have these numbers. They're high for us because we just haven't seen them this high, and we have been probably overachieving for a community our size for a long period of time, but that means we know we can meet those marks. So I'm concerned about people's behavior. There's no question. I know there's an election going on. People are focused in on that. People are sick of the pandemic, but we just got to get through this. We got to grind this out, and we got to be smart. We have to get tested. There's going to be opportunities for people to have gatherings, want their families to be together. I think it's a great idea for people, if you're going to be together for Thanksgiving, that you all go get COVID tested. I think it's a very good idea. I just think some of these times we've been extending our social circles on weekends and things like that. I think you got to bring it back a little bit, reel it back in a little bit. And everybody's been guilty of it. I've been guilty of it too. So now things have changed. The virus is here in the community everywhere. Before, we could point to that cluster, or this cluster, or this cluster. I got too many clusters now. You have birthday parties, you have weddings, you have restaurants, you have manufacturing where people are just going to work, but they're going to work sick and getting other people sick. You have other large employers, it's happening. You have governments that are getting cases. So these are all things that it's just everywhere now. We got to re-engage.
Is it enough to rely on public being smart, or are you thinking about any new restrictions like mandating masks in schools?
So most schools have mask wearing right now. There are a couple districts that do not. We're pulling all the data on those districts right now. That's something I can now do. And so we're looking at that to see where we are with cases. We may preemptively do some things there anyways, just because I think some of the concerns in the beginning of the year, some of the feedback was, will the kids wear them, right? They're not going to wear them. I think we've probably proven that the kids will wear the masks at this point. So we're taking a look at that. I'll have a decision on that next week after talking to some of the districts that don't, what they're seeing in their buildings, then looking at the cases, and then looking at what's happening in the community, because that could pose more risk. So, but we're looking at things we can do locally, surgically, that will help with the issue. Again, enforcement. We got data. We know things now. We've seen a pattern. We're going to go enforce stronger now, proactively enforcing. And we're telling everybody right now, we're looking for these things. We have a problem now. And so we can't, as a community, interact as much the same ways that we were in the summertime because the virus is more prevalent now in our community.
Are you hearing from contact tracers, are people who go to work sick telling contact tracers, look, I don't have sick pay, I don't
I think there's probably certainly that's part of the rationale with some people, Tim. I think there's certain protections right now that maybe people aren't aware of related to employers, and so that's part of it, right? And part of it is just culturally we wake up and go to work, and we don't pay attention as much to certain things. So that's a challenge, and I think that is what drove the uptick, right? People going to work sick, so then it's spreading more, and now it's a little more prevalent, so it's a little bit more risky to do some of the things that we could have done a month ago.
Ryan, you talked a couple weeks ago about maybe trying to get some Syracuse students into a football game. Did you talk to the state at all about Wake Forest, and does this uptick change your hopes moving forward?
Yeah, so a couple things there. I think part of the we did talk a little bit to the state about Wake Forest. I think the challenge for Wake Forest is that we had a cluster, we got through it. The university's gone on a huge testing regimen. The data's fantastic, but it's been about a week, right? So again, in this thing, usually you want to see 2 weeks of strong data. Then I have a better case to make. The university has a better case to make to the state. And the nice thing about what we're proposing, and again, if you look at our data, 1% out of the top 8 counties, big ones, nobody's got a 7-day positive rate at 1%. We do. But I'm telling you that the number of cases we're getting are still too high. But when you look at the university in their own bubble, right, their bubble, and their data is much better than 1%. So if you're in a situation where a week from now they have a very good positive rate, there's a commitment to test the students on Thursday, quarantine them Friday, let them see a football game Saturday, I'm willing to make that argument to the state. Whether the state listens, that's their call.
What's your we're seeing across the country, right, places with worse positivity rates put out limited capacity plans for college basketball season. I guess what's your level of optimism here since it's less than a month away?
I think we need. I think testing should be part of any sort of gathering, non-traditional gathering. So, if we can prove that people don't have the virus, because we're testing and rapid testing becoming more available. The university has some rapid testing. They don't have as much of it that they want. But again, if you can prove that people don't have COVID, then what's the danger of them being together, right? Not getting COVID. So I think that's going to have to be part of any plan for hoops. And certainly I think that as this technology with rapid testing is evolving, and it is, that will hopefully bring more opportunities to do things like that. But I think rapid testing, not just your regular test 72 hours before, a lot can happen in 72 hours. Your rapid testing hours before a game. I think there's an argument there that maybe the state would be receptive to.
And I know at one point you had a regional committee, right, where you were in discussions with the state and they heard you out fairly frequently. What's the process as far as kind of getting this on their plate right now and getting them to consider it?
Yeah, so we still have our Monday and Thursday regional control room calls. We had one today. This is more about infrastructure now and fighting the virus now. This, in the shift here, we have gotten the plans and how the proposal, how they can do this safely to state DOH, and there's been people from the executive chamber engaged in those calls as well. So they have the plans, and I think they're very well thought out, very good plans, and hopefully if there's another great week of data and strong testing at the university, then that strengthens the story that it's not on this campus, and we'll even test these kids again before they go into a building, and we'll sit them very far apart in areas of which their dorms they all live together in anyway. So I think there's ways to do it safely with that, and I don't think what's going on from a the rest of the county standpoint impacts that, because when the state's looking at parts of the state as a whole, Central New York's still kind of a pretty big bright spot for them as to good positive data.
How do you define a small cluster versus a big? What are the small cluster numbers being, and what's this one wedding big cluster producing number of cases wise?
Yeah, I would say a small cluster is about 5 to 15 individuals, larger cluster over 15.
So this wedding's produced more than 15 cases?
Yeah.
More than 20?
I don't know over 20 yet, but the assumption is once you quarantine those folks, that those in quarantine might, just because of how many cases you had, will probably come down with it. And again, with our quarantines, I want to thank our health department. They've done a fantastic job. Even though tomorrow's number is going to be a bad number, what I'm being told is close to a third of those people are already under quarantine and they're just getting sick now. So that's means they did something right to get everybody where they needed to be.
Oneida County had 50 students exposed because of a house party.
Mm-hmm.
How important is it if people are thinking about having a Halloween party or whatever to not?
This is a real bad idea for parents, and I don't know if the parents were involved in that one or not. I was on a call earlier where I know that other parts of the state there was a party and the parents were actually involved with it, so they got a big fine and they might even have bigger legal problems. This is a bad idea, and so I get your kids of kind of, they're at school, they want to be with their friends, they want to do things on the weekend. I get it. It's we can't do it, and we'll enforce it. So we heard about one. We preemptively reached out to people. It's a bad idea, and so and right now it's against the state's executive orders. So we can't get away with those things when it's in the community the way it is right now.
The county got wind of an upcoming Halloween party and shut it down before it happened?
Yep. Other questions?
You got wind of it. Do you encourage people to start giving you wind of more things?
We usually hear about this because, remember, most people don't think these things are good ideas, right? So they hear about it, their teenage son or daughter, they hear about it, and they do a little digging, they find out more information, and then they tell us. And so then we then do our information, then we reach right out to the source and say, this is what we're hearing. It's against the executive order. This is a bad idea. If you do this, there's going to be a problem. And they usually work with us very quickly and want to resolve the situation. So that we preemptively had these discussions, whether or not these individuals knew that their kids were planning on having one or not. They know now, and it won't happen.
You mentioned burnout among the contact tracers. Are you having to cut back on other county services to supplement those ranks?
But we will certainly be redeploying people from other staffs, especially going into the holiday seasons where people are going to need some time. And so we're going to manage that. And I think the state's in the process of, with Bloomberg, with the contact tracing system they have, with beefing that up as well as everybody's gotten busier. So I think overall it's getting addressed now as we realize that the activity level is going to be high. A good day is going to be a busy day. And so we're prepared for that. That's what our normal is going to be moving forward. And so, but we still need to acknowledge the Herculean efforts of the health department and what they've done, and they're going to need a break. Everybody's got a breaking point, so we got to manage that. That's what we're working on.
Do you have the quarantine number?
Yeah, 1,647.
Did you vote yet?
I have not voted yet. I debating. I usually vote in person. Depending on how busy things are here, I might do an early vote just to get it out of the way. But I have not voted yet. Other questions? Okay. Thanks, everybody. We'll see you on Monday.